Did you know that in the U.S., nearly 250,000 people die every year due to medical errors? Medical mistakes can range from mix-ups with medication to complications from surgery that go unrecognized and untreated. Joining us with tips on how to minimize your chances of a medical error is Dr. Freda Lewis-Hall, the Chief Medical Officer of Pfizer, who joins us.
Well, you know, not all of us are trained as doctors, but everybody can play a role in preventing medical errors. Now, the best way to do that is to take an active part in your health care as a part of the team. Research tells us that patients that are really involved in their health care tend to get better outcomes.
Well, let's talk about getting involved and an example of how someone can do that.
First of all, you want to give all of the information that you can have available on your health care. Talk about your hospitalizations, your surgeries, your family history, and all of your medications, prescription medications and non-prescription medications. So don't forget to include dietary supplements and vitamins. Write it down, keep it updated, and be prepared to take it every time you go to a new doctor or into the hospital. The get is to make sure that you have all of the information that's being provided to you in terms that you can understand. You want to make sure that you really understand what your diagnosis is, what the treatment plan is, and all of the medications that you might be given.
Also talk to your docs about any allergies you have, maybe a bad reaction you've had in the past to anesthesia. This can help you avoid getting medicine or procedures that could potentially harm you. And if a procedure is recommended by your healthcare provider, ask why and what the treatment plan will be during and after. If you're too sick or don't feel comfortable asking these questions, which often happens, take a relative or a friend with you to the doctor's appointment to help you ask questions, but more importantly, understand the answers, and always feel free, we talk about this on the show, to get a second opinion.
And the other tip I wanted to give is, don't assume about medical tests that no news is good news. So if you're not getting the results of your test, you want to ask, what are my results? What does that mean? And then what are we going to do next about that?
And let's talk about the most common and most avoidable type of medical error. Did you all know that 88% of medical errors involve the wrong drug or the wrong dose?
When your doctor writes a prescription and hands it to you, if you can't read it, it can be that your pharmacist can't read it either.
Handwriting? Doctor's handwriting?
Oh.
Really? I never heard that one.
Who said that? So make sure that it is legible. And now we're doing electronic prescriptions.
Yep.
So when your doctor is calling in a prescription or sending in a prescription, find out what it is. Write it down. So when you get to the pharmacy, you can actually take a look that what you heard you were going to get is actually what you're receiving. And then there are a series of questions that you should ask every time you are prescribed a medicine. What is this for? How much am I taking in for how long? I want to know whether or not there are likely side effects. What are those, and what should I do if I'm having those side effects? Are the other medications that I'm taking okay to take with this? And you also want to ask, is there some food, drink, or activity that I should be avoiding while I'm on this medicine?
Picking up medicine from the pharmacy, that's another really good time to ask questions that you may have. Find out if the medicine your doctor prescribed, make sure it's the right one, check for the correct dosage, find out when, how, and with what to take that medicine. Read the information that comes with the medicine. And if the medicine looks different than what you've been used to taking, speak up. And when you get home, this is important. Don't just grab a spoon out of the kitchen drawer to take medication. Spoons are made of different sizes. A household teaspoon, not necessarily the same size as a real, true teaspoon. So it's important, especially with kids, to make sure you're giving the proper dosage and using the proper vessel to measure out that dosage.
Some common mistakes are, people sometimes confuse eardrops and eye drops. They chew medicines that are not supposed to be chewed. They cut or crush medicines that they shouldn't. And the other thing is, store the medicine in the container that it came in with the label on it. And that way you don't make mistakes later. And then, that piece of white paper that you get stapled to the bag when you go to the pharmacy, keep it and make sure that you have it available to you and that you understand everything on it. So on Get Healthy, Stay Healthy, we've put a medication tracker that can be downloaded and used later. And we've also put some information that will be helpful in reducing the chance of medication errors.
Dr. Freda, thanks for discussing such an important topic here today. We'll be right back, everyone.